My gracious favor is all you need. My power works best in your weakness. So now I am glad to boast about my weaknesses, so that the power of Christ may work through me. 2 Corinthians 12:8.
Life is hard in Ethiopia. People live on a day-to-day basis. The amount of money you make in a day dictates how much you're able to eat the next day. Despite the hardships, the people of Ethiopia have a will for survival. Gimbie Hospital knows its share of hardships, but continues to serve its community with the same tenacity possessed by the people. Gimbie Hospital plays a crucial role in its surrounding community. The hospital serves 15,000 outpatients and 3,500 inpatients annually. Henrik Tesfa has lived in Gimbie all of his life and now works as the head accountant for the hospital. He understands the importance of this institution to the surrounding area.
Gimbie Adventist Hospital is a 71-bedded hospital, and we have private ward, male ward, and as well as female wards down there. And we have one surgeon, one obstetrician, and 2 GPs, and 1 health officer and 1 BSc nurse. Those GPs and health officer and BSc nurses work at OPD during the daytime, and as well as they used to cover on-call shifts. And we have 7 clinics affiliated to this institution at different rural areas of Gimbie town. One of those clinics, for example, exists at a place called Green Lake, where it's very important to the societies which live out there, because people have nowhere else to go in order to get treated. And it's a place where we really need to work, and those clinics which exist at different places need to be reset up, because most of their materials are getting damaged. And especially in particular way about the Green Lake Clinic, it's a place where the societies are really in need of and where we should work on it.
The reason why this hospital is necessary for Gimbie is only this hospital is serving in Gimbie. No another hospital from the beginning still now. But now the government is start building a hospital, but that is not yet. It's not start to work. But this is the only one, as I said now, helping the countryside people, the poor people without payment. Still now, only this hospital. That's why we would like to help this hospital, even in the future.
Regatu was dying of TB and its multiple complications. She had no money. The hospital took her in, and a donor covered all of her medical costs. After months of hospitalization and prayers and every possible treatment tried, she was discharged to go home and die. At most other hospitals, a patient with no money in a hopeless situation isn't given any care because no one wants to gamble on them. Sometimes these gambles do seem fruitless, but by fighting for the otherwise rejected, we lend value to life. It's a sad story when someone dies after being fought for, but it's heartbreak when someone dies without any fight at all. And it happens all the time. There aren't enough donors to cover the patients who come in. Our charity budgets are at an all-time low, and many patients must be turned away. This story ends well. After several months, Regatu was found to be completely recovered from her illnesses. Despite the odds and outcome of any case, the gamble is always worth it.
While Gimbie Adventist Hospital provides a vast number of services to the surrounding community, it faces an equal number of challenges that aim to hinder the work of the hospital and its staff.
Because people come from countrysides and different far places, need food service here, but our service here, due to the lack of instruments, people will not get, and especially some of them are referred to far place of Addis Ababa to find good service.
One of the challenges here we are facing from the business point of view here is our expense used to exceed much higher than the income we collect. 1 month, for example, on August month, our expense goes about 15,000 above the income we used to collect. This is because of the reason patients don't have much money to pay out their bills, and if we had that amount of or some amount of money in our charity funds, we used to pay out the hospital so that the hospital will get or will not lose that amount of money. Another which is really a big need to the institution is that we need surgeon. For example, the surgeon we have right now, we are paying him about 20,000 per month, which is almost 1/5 of our payroll. That means if we get kind of surgeon who can come out from abroad, kind of voluntary surgeon for even 3 months, anybody can imagine how much it will be help to this institution.
The 6 outlying clinics have proven to be one of the biggest challenges faced by the hospital. Lack of medicines, inadequate staffing, and poverty-stricken rural locations have resulted in the clinics being unable to support themselves. Despite the clinic's problems, they are vital to their communities, serving 12,000 people annually.
The outer clinics are having a number of problems, like shortage of doctors, because the clinics are run by nurses only, and the service which is given in the clinics are very short and small, and it never meets the need of the patients. In order to solve this problem, it is I think very important to have volunteer doctors so that they can give a service for the community and solve these problems.
Here at Gimbie Adventist Hospital, we face challenges on many levels, but with God's help, we're continuously improving the health care that this hospital offers to the community.
While these challenges seem to stand in the way of progress, it is apparent that God has a plan for the hospital, its staff, and its patients.
Whatever the problems, I see God helping us in any difficult situation and working with that. And at the time when payroll approaches is the time when high tension comes most of the time, because there is no money. We used to spend our money for purchase something like that, and we were kind of just thinking where would we bring the money and everything. But that time I see God working and providing us the money to pay out the workers' salary and everything we need. God is really blessing us and providing us whatever we asking on a time.
There was many problem past time, but God is still supporting this hospital for several years, and still the hospital is standing on his own.
Because of spiritual life is changing for community, they are praying for the patients, for the workers in the hospital, and different kinds of spiritual activity is going very well, deliciously in the Gimbie Adventist Hospital. That's why it makes different from other hospitals.
There is a church within the hospital, even around the clinics. The hospital and the church working together and just teaching about God. And even us, we workers, are getting many God's word every morning, including non-Adventist workers. So many people are just turned to God because of this hospital.